My name is Malia Prevost. Today we are going to explore the history of animal-assisted therapy and its current role in practice. So what is animal-assisted therapy, or AAT? In short, the AAT approach is the therapeutic interaction of a patient and a trained animal with the intent to promote progress towards the client's functional goals. So now we're going to look at animal-assisted therapy in history, its introduction, and how it has become common in practice. In the 1940s, the practice of AAT was introduced in the United States. However, the use of animals in a therapeutic aspect has been practiced for centuries in other cultures and parts of the world. Research has shown that animals may be useful to assist the patient's participation in therapy during clinical interventions to reduce anxiety, fear, and depression. There are many stories about the use of animals during the recovery of ill and injured individuals, from John Locke, Florence Nightingale, and Dr. Charles Mayo, head of the Mayo Clinic. AAT is growing in use within specialized settings such as hospice or terminal care, psychiatric hospitals, schools, and to ease the transition of elderly between facilities. Dogs have been used to address widespread medical and psychological disorders. Most people are familiar with service dogs such as guide dogs for blind individuals, hearing dogs for those who are deaf, assistant dogs for people with various handicaps, and even seizure alert dogs. The implementation of dogs for psychological issues has only recently been introduced to the general public. So let's look at animals in OT practice. The occupational therapy practice is anchored in 7 core values: altruism, equality, freedom, justice, dignity, truth, and prudence. The core value of altruism states that one will demonstrate concern for the welfare of others. The first principle of occupational therapy is beneficence, which states that practitioners shall demonstrate a concern for the well-being and safety of the recipients of their services. These concepts state that occupational therapists should be concerned with their patients' welfare, practice kindness and compassion, and provide a safe environment where they can be vulnerable enough to expose and address their areas of weakness or need. It is a good practice for occupational therapy practitioners to stay up to date and well informed on techniques or tools that can improve patient comfort and ability to engage at their highest level. Research supports that AAT is a valuable element in reducing a client's anxiety and strengthening perception of a safe environment. Animals in many situations can create an instant change in a patient's state of mind and level of comfort. Individuals who have service dogs often report an increase in social engagement and acceptance from strangers when their animals are present versus when they are not. The animals provide a common ground for the disabled individual and the passerby, a topic that they can talk about comfortably. The presence of an animal can create an environment that patients describe as disarming and energizing. The animal could be there for comfort, or better yet, utilized as a therapeutic tool. The patients can practice caring for the animal by performing feeding and grooming tasks, sequencing and balancing activities, just to name a few. Research supports the importance of collecting adequate patient history to determine if the patient has had negative or positive experiences with animals. So it is essential that the therapist complete a thorough review of the client's past experiences with animals, educate them on the risks and benefits of AAT, and clearly explain the procedure and treatment intervention plan. The therapist's responsibility is to ensure that the use of AAT will not have adverse effects such as inducing fear, anxiety, or allergic reactions in their patients. Therapy can be difficult and challenging, but for many individuals, having interactions with the animals is rewarding and motivating. The more ways a practitioner can make intervention engagement enjoyable for their client, the greater the benefit and quality of their occupational and therapeutic participation. So let's look at the client benefits of animal-assisted therapy. Animals can help reduce a patient's anxiety, fear, and depression during clinical interventions. Research involving therapy-resistant patients diagnosed with dementia reported that strong bonds were cultivated between the patient and the animal during AAT. Researchers believe that AAT's effectiveness is due to the ease at which the bond between humans and animals develops. Interaction between clients with dementia and dogs help reduce the presence of apathy, anxiety, and behavior issues. The client's aggressive and wandering behaviors were mitigated when encouraged to groom and walk a therapy dog. Therapeutic interventions that include therapy dogs increased the client's physical activity, aided in mastery of challenging tasks, and improved their quality of life. In addition to the benefits seen when implementing dog therapy with clients diagnosed with dementia, research results did not support the concern that the increased physical activity and mental stimulation might increase problematic behaviors. Niemer and Lundell completed a meta-analysis which showed improvement in medical well-being and behavioral outcomes at a moderately strong level when utilizing AAT. There has been numerous studies reporting on the benefits of AAT on depression, decreasing anxiety during medical procedures, decreased suicide, and minor health problems among individuals who had a pet in their home. Veterans under treatment for a post-traumatic stress disorder report that service dogs help them stay focused on current situations and activities, reduce the occurrence of symptoms, and re-experiencing the past trauma. Other benefits reported with AAT in veterans are reduced hyperarousal, suicidal ideation, reliance on medications, improved sleep habits, social, community participation, and the realization of meaningful goals. The use of non-pharmaceutical interventions, such as reminiscence, music, and behavioral therapies, are preferred for clients in long-term care facilities. Non-pharmaceutical interventions reduce healthcare costs, side effects of psychotropic medication use, improve client dignity, and occupational participation. Having a variety of intervention approaches to address patient deficits without the use of pharmaceuticals is best practice, and research indicates that AAT is just as beneficial as other commonly used techniques. To address mental health concerns, AAT has significant implications for reducing anxiety, fear, and modeling appropriate social interactions. Diagnoses that present with difficulty demonstrating appropriate social interaction and communication skills, such as autism and schizophrenia, can observe examples of acceptable social interactions and nonverbal communication through the therapist and the animal's interactions. Animals demonstrate communication characteristics that are not seen in humans, positively impacting individuals and providing clear and direct nonverbal communication cues. During AAT interactions, clients receive immediate and concrete input regarding how their actions affect others, which allows them to have the opportunity to practice self-control. Animals react to indirect and nonverbal responses. These negative and positive interactions contribute to the client's development of acceptable behaviors. The animal's non-judgmental acceptance of the individual also supports the development of the client's self-confidence. Individuals who are at high risk for isolation experience improved socialization when they are pet owners. These effects are largely due to the physical and emotional demands required for caring for a pet, such as taking them for walks, feeding, grooming, and the social component. Individuals with disabilities report that strangers are more likely to engage them when an animal is present. The presence of animals improved the initial introduction between strangers, acting as a social lubrication. Dog-assisted socialization activities such as playing fetch reduced depression, encouraged physical activity, and elicited a smiling response in participants. Older adult participants reported that AAT evoked pleasant memories, and they recommended the interventions to others. Regarding AAT in therapeutic settings, Fine stated, "The conclusion suggests that the animal-based programs are a good distraction from the medical interventions and treatments." Several studies have demonstrated significant changes in blood pressure in patients with AAT. One study looked at changes in neurotransmitters as well as blood pressure. Udendall's study in 2000 reported a significant decrease in blood pressure. Endorphin, oxytocin, prolactin, phenylacetic acid, and dopamine increased significantly, and a decrease in the stress hormone cortisol. The study also revealed that the animal interaction only needs to be between 5 and 24 minutes to achieve physiological effects. Increased interaction frequency was more beneficial than the length of the individual sessions. The use of animals during medical procedures and examinations decreases the need for anesthesia and sedative medications, reducing side effects and medical costs. Once the client becomes familiar with the animal, the mere presence of the animal has a profound impact on fear and anxiety associated with medical procedures and prior to surgery, even when contact is not possible. Therapy animals, what types, becoming a therapy dog, and the certification process. Although many animals can be used for animal-assisted therapy, classically it has been small animals such as dogs, cats, rabbits, birds, and guinea pigs. The most common form of AAT uses dogs and cats, with dogs having the highest prevalence. The use of large animals in AAT is gaining popularity, primarily using horses. This is termed equine-assisted therapy or hippotherapy. However, on occasion, more exotic animals such as dolphins and elephants are utilized. For an animal to be considered for AAT, it must be in good health, up to date on all annual shots, and certified as a therapy animal by a trusted association. An animal's certification process is relatively easy, but it may be time-consuming. Dogs and cats must be at least a year old at the time of their evaluation. Smaller animals such as rabbits, guinea pigs, and rats must be 6 months old. The animal must have been living in the home with the owner for at least 6 months, be toilet trained, and on a diet free of raw meat, and have no histories of inflicting harm or demonstrating aggression towards humans or other animals. The animal is required to follow basic commands, walk on a loose leash for dogs, welcome interaction with strangers, and wear a therapy vest. The certification of a therapy dog is also determined by the relationship between the handler and the dog. The handler is required to recognize and respond appropriately and immediately to their dog's body language and when exhibiting signs of fatigue, frustration, or anxiety. The owner must be able to control and instruct the animal without the use of force, treats, or raising their voice. Once the animal meets the above criteria, the next stage is an evaluation by a tester. The evaluation consists of observing the animal and the owner in a handling demonstration. After completing the handling test, the tester observes the animal during 3 visits to a volunteer facility. The purpose of this presentation is to show that evidence supports the use of animal-assisted therapy in the practice of occupational therapy. Positive changes in blood pressure, heart rate, hormones, and neurotransmitters associated with well-being are a benefit shared mutually in both the human and the dog during positive interactions. Humans and dogs alike are social beings and do not thrive well in isolation. The information supporting the benefits of AAT is vast and relates strongly to the underlying principles of occupational therapy. Thank you for watching this presentation. This was designed as part of a Master's in Occupational Therapy Capstone project. I hope it was informative and your time was greatly appreciated.